Did you know that seemingly harmless medications, such as those for headaches, sore throats, or even vitamin supplements, can negatively affect heart function? If you notice symptoms like excessive fatigue when climbing stairs, chest pain, or disproportionate shortness of breath, the cause might be a medication you're taking without suspecting its side effects. Surprisingly, many over-the-counter medicines sold in pharmacies can be toxic to the heart, including those you've considered safe for years. In today's video, we're diving into a super intriguing topic: 6 common medications that can cause serious heart failure, harming your heart or worsen existing heart conditions. Some, when combined, can even be fatal. Number 1 on our list is one of the most widely used medications and also the most problematic for the heart. Would you like to know if any of the medications you regularly take could be on this list? Stay until the end to find out. Before we get started, take the opportunity to like the video, subscribe to the channel, and turn on notifications to regularly receive our health tips. Share this knowledge with friends and family. Your action can help many people take better care of their heart health. And you, do you take any medication regularly? Do you have any heart condition? Where are you watching from? Leave your comment below. 6. Diabetes medications. Controlling diabetes is usually good for your heart, but some popular diabetes drugs can cause serious problems. Metformin is generally considered the safest diabetes drug, but it can be risky for people with kidney problems. Your body gets rid of metformin through your kidneys, so if they're not working well, the drug can build up to dangerous levels. More concerning are thiazolidinediones like pioglitazone and rosiglitazone. These drugs cause fluid retention and weight gain in people who already have heart failure. And in people who don't have heart failure, they increase the risk of developing it. Then there are dipeptidyl peptidase 4 inhibitors like sitagliptin and saxagliptin. The evidence here is more recent and somewhat controversial, but several studies have found that these drugs increase hospitalization for heart failure. The mechanism behind this isn't fully understood. It might be that by altering glucose metabolism, these drugs somehow stress the heart, or it could be an off-target effect on heart tissue. Whatever the reason, it's clear that diabetics need to be extra careful about their choice of medication. 5. Blood pressure medications. This one is particularly tricky because high blood pressure is itself a major risk factor for heart failure, so you need to treat it, but some of the treatments can cause problems. Calcium channel blockers are one example. These drugs can worsen edema, the buildup of fluid in body tissues. This extra fluid puts strain on the heart. Central agonists like clonidine and moxonidine are another concern. They alter the way your body releases hormones that affect your heart, which can lead to problems. What's interesting here is the balancing act doctors have to perform. They need to lower blood pressure to reduce the risk of heart failure, but they have to be careful not to use medications that themselves increase that risk. 4. Over-the-counter drugs. This one is scary because these medications are so easily available. You don't need a prescription, so there's no doctor checking whether they're safe for you. We've already talked about over-the-counter NSAIDs, but there are other culprits too. Many cold medicines contain decongestants that narrow your blood vessels. This is fine for most people, but if you're at risk for heart failure, it can be dangerous. The label will usually say vasoconstrictor, but how many people know to look for that? Some cold medicines also contain high levels of sodium, which can be a problem for people with heart issues. And let's not forget that many of these medicines contain NSAIDs too. So you might think you're just treating a stuffy nose, but you're actually taking a cocktail of drugs that all increase your risk of heart failure. 3. Supplements. This one is particularly worrying because supplements aren't regulated the way drugs are. The FDA doesn't check whether they're safe or effective before they hit the market. So you're relying entirely on the manufacturer's word. Even seemingly innocuous supplements like vitamins can be risky. For example, taking more than 400 IU of vitamin E daily has been linked to an increased risk of heart failure. And that's a vitamin, something we tend to think of as universally good for us. Other supplements can interact with heart medications in dangerous ways. For instance, some herbal supplements can interfere with blood thinners or digoxin, a common heart medication. And because people often don't think of supplements as real medicine, they might not mention them to their doctor. 2. Antifungal medications. Itraconazole, an antifungal medication, has been linked to cardiotoxicity, hypertension, ventricular fibrillation, increased ventricular contractions, worsening heart failure, and a higher risk of developing new heart failure. The FDA advises that it should only be prescribed to patients with ventricular dysfunction or heart failure in life-threatening fungal infection cases rather than for treating onychomycosis. On the other hand, amphotericin B carries a greater risk of new dilated cardiomyopathy and heart failure, though these symptoms may improve once the medication is stopped. 1. Non-steroidal anti-inflammatory drugs. NSAIDs are probably the biggest offender. These are pain relievers like ibuprofen, naproxen, and diclofenac. More than 70 million prescriptions are written for NSAIDs every year in the US alone, and that doesn't even count over-the-counter use. The problem with NSAIDs is threefold. First, they make your body retain water and salt. This increases the volume of blood your heart has to pump, making it work harder. Second, they constrict your blood vessels, again making your heart work harder to push blood through. And third, they interfere with diuretics, drugs often used to treat high blood pressure and heart failure. The net result is that NSAIDs can push someone who's on the edge into full-blown heart failure, or they can make existing heart failure worse. This effect is so strong that even short-term use of NSAIDs has been linked to increased hospitalization for heart failure. What's particularly insidious about NSAIDs is that they're often used to treat conditions that themselves increase the risk of heart failure. Arthritis is a good example. So you have people who are already at elevated risk taking a medication that further increases that risk. It's a double whammy. So what should you do with all this information? The key is to be aware and to communicate with your doctor. Here are some practical steps. Make a list of every medication and supplement you take, including over-the-counter drugs. Bring this to every doctor's appointment. If you're at risk for heart failure, for example, if you have high blood pressure or diabetes, ask your doctor specifically about the heart safety of your medications. Be cautious with over-the-counter drugs, especially if you're in a high-risk group. Read labels carefully and ask a pharmacist if you're unsure. Don't assume that natural supplements are safe. They can be just as risky as prescription drugs. If you need to take NSAIDs regularly, for arthritis, for example, talk to your doctor about alternatives or ways to minimize the risk. If you're diabetic, make sure your doctor's up to date on the latest research about diabetes drugs and heart failure. Don't stop taking any prescription medication without talking to your doctor first. The risks of untreated health conditions often outweigh the potential risks of the medications. It's also worth noting that the risk isn't the same for everyone. Factors like age, overall health, and other medications you're taking all play a role. A drug that's risky for one person might be fine for another. That's why it's so important to have an open dialogue with your doctor. We often talk about the marvels of modern medicine, and rightly so. Drugs save countless lives every year, but they're also powerful substances that can have unintended consequences. This situation with heart failure is a good example of how complex medicine can be. It's not just about finding a drug that treats a condition, it's about weighing the benefits against the risks, considering how different drugs interact, and tailoring treatment to each individual patient. It's a delicate balance, and it's why we need skilled doctors who stay up to date with the latest research. It's also a reminder of how much we still have to learn. The link between some of these drugs and heart failure has only been discovered relatively recently. Who knows what other effects, good or bad, we might uncover in the coming years. For patients, the takeaway is clear. Be an active participant in your healthcare. Ask questions, do your research. Don't be afraid to bring up concerns with your doctor. And remember that more isn't always better when it comes to medication. For doctors, the challenge is staying on top of a rapidly evolving field. New drugs are constantly being developed, and our understanding of existing drugs is always expanding. It's a lot to keep track of, but it's crucial for providing the best possible care. For researchers, there's still a lot of work to do. We need to better understand the mechanisms by which these drugs affect heart function. We need more studies on long-term effects and on how different drugs interact. And we need to develop new treatments that are just as effective, but with fewer side effects. For drug companies, this is a wake-up call. The pressure to bring new drugs to market is intense, but safety has to be the top priority. Post-market surveillance, tracking how drugs perform in the real world after they're approved, is crucial. And for regulators, it's a reminder of the importance of their role. The FDA and similar agencies around the world have a tough job. They need to balance the need for new treatments with the imperative to protect public health. Cases like this show why rigorous approval processes and ongoing monitoring are so important. For now, the best approach is awareness and communication. Be aware of what you're taking and why. Communicate openly with your healthcare providers, and stay informed about new developments in medical research. In the end, your health is your responsibility. Doctors, pharmacists, and other healthcare providers are there to help, but you are your own best advocate. By staying informed and engaged, you can help ensure that the medications you take are helping, not harming your heart health. If this video helped you out, why not give it a quick like and share it around? It could really help someone else looking after their heart health. Do you or someone you know take any of these medications? Drop a comment and let's chat about it. If you want to stay in the loop with more health tips, just hit that subscribe button and turn on notifications. We release new videos every week. Your likes and comments really keep us going. They show us what you want to see more of. And before you go, check out these 2 videos we selected specially for you. I think you'll love them. Have an awesome day and remember to take care of your heart. Thank you for watching. See you in the next video. Bye.